Hello, my name is Marcus Chavez and I'm with FR TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by Cindy Zahnd, who is with the University of Bern in Switzerland. Cindy talks about a computer-simulated study that looks at the impact of deferring HCV treatment in HIV-HCV co-infected patients, where patients would be treated when reaching advanced liver disease versus treating soon after diagnosis.
Hi, I'm Cindy Zahnd from the University of Bern in Switzerland. And the study I'm going to talk about is a computer simulation study where we looked at the impact of deferring HCV therapy until advanced liver disease in HIV-HCV co-infected people. What we wanted was to model several scenarios where people would either be treated when they reach advanced liver disease, so stages F3 or F4 on the Médaire's scale, versus treating patients sooner. So for example, in Médaire's stage F2, when they still had limited liver fibrosis, or treat patients soon after diagnosis, regardless of their liver disease stage. And I have to say, we make an important assumption, that is that successful HCV treatment would, and it's an assumption that is based on already published literature, that successful HCV treatment would greatly reduce the risk of liver disease progression, but it does not eliminate it completely. So we assume that the rate of liver disease progression was 10 times lower in patients who had successfully cleared HCV as compared with those who had detectable HCV. And our model shows that deferring HCV treatment until liver disease stage F3 instead of treating in F2 basically doubled the proportion of patients who died of liver-related complications. So this proportion increased from 5 to 10%. And if treatment was further deferred until F4, then this percentage of liver-related death increased to 25%. And again, this is because we assume that although successful HCV treatment greatly reduces the risk of liver-related complication, people who live with HIV have many other risk factors that maintain them at a certain risk of progression even after HCV clearance. And the other important thing that our model shows is that deferring HCV therapy also obviously has implication in terms of the risk of transmission. And so we showed that if treatment is deferred until F4, instead of being provided soon after diagnosis, the average infectious duration was increased fourfold.